Friends, welcome to Geriatric English channel. I am Dr. Keshwamurthy from Shumaga. Now I will tell you about a few heart diseases. Dear friends, in my previous episode number 2, I have told you about the changes in the structure of the heart due to aging. Many of you have already seen it. Now I shall tell you about a few heart diseases. This information may develop interest in the channel viewers. I am telling you out of my experience as a writer of medical articles in Kannada language in magazine Taranga Weekly of South India. I have published nearly 400 articles, out of which 25 are the cover page articles in that magazine. In this episode, I shall briefly explain the diseases of the heart. The first and foremost complaint with which the patient comes to the clinic is chest pain. Often, patients rush to the doctors with a lot of anxiety. Majority of the times, it is not due to heart disease at all. It is called non-cardiac chest pain or NCCP. It is due to disorders of the other structures surrounding the heart in the chest wall. When it is due to heart, it is called angina pectoris. Pain in the center of the front chest wall behind the sternum. Chest wall, that bone is also called the chest bone in general public. It is known as chest bone. Breathlessness on walking and work and dyspnea on exertion, DOE, is the first and foremost symptom with which the patient comes to the clinic. Then it is because of accumulation of cholesterol in the coronary arteries and results in arteriosclerosis, which causes the arteries and the smaller arterioles. Smaller arteries are called arterioles. They become stiff. Fat accumulates in the walls of the arteries from inside, so its diameter becomes shorter. Sometimes complete blockade takes place in coronary arteries, which causes the heart attack. And the next symptom is the breathlessness due to congestive cardiac failure, CCF. It takes place in some senior citizens. It is 10 times more common in them than the middle-aged people. What is congestive cardiac failure? I will tell you in my next episode, one of the next episodes. Arteriosclerosis is also called atherosclerosis, results in chest pain and, if neglected, may lead to heart attack also. Here, the blood pressure increases. There will be orthostatic hypotension also, which causes dizziness in them and they complain of giddiness actually, which is known as vertigo in medical world. Dizziness is different, vertigo is different. Here only the dizziness takes place in them, which is very mild. The valves of the heart weakens. Valves of aorta frequently becomes incompetent and stenosed. Blood supply to the brain through one of its arteries becomes less. That artery is also a branch of aorta, and it is the part of the because of the to poor the blood supply, the part of the brain function becomes weak. It is called TIA, that is transient ischemic artery. Corresponding to the part of the body at which TIA has taken place, the part of the body gets paralyzed or weakened temporarily. If left neglected, it may result in paralysis in future. Paralysis means it is also called hemiplegia in medical term. Blood clots in the veins, in deeper veins of the legs, is called DVT or deep vein thrombosis. Clots may escape and reach brain, which causes paralysis. The clot usually gets separated from the bigger clot. A small piece of that gets separated from the blood clot and escape through the bloodstream to the brain or the heart, which causes the corresponding illness in them. Because of the low blood supply, pain starts in the legs while walking. It is called intermittent claudication. Pain disappears on taking rest. Weak blood vessels and its walls, that part of the artery is known as aneurysm. In case of arterioles of the brain, it is called aneurysm, and elsewhere also, results in varicose veins. Legs becomes heavy and painful. So these are the usual complaints with which the patient with heart disease comes to the doctor. Okay, then how to prevent these heart ailments? Now let us consider the daily habits. Eat healthy food daily. It should contain less cholesterol, less saturated fat. Let the body weight be about 60 to 70 kgs. Consult your doctor to control BP and cholesterol. Exercise regularly. At least half an hour of walking per day is ideal. It will reduce obesity, blood pressure, diabetes, anxiety, etc. It increases the blood supply to the brain. The exercise to the body is the best drug to increase the blood supply to the brain. It should be noted. So exercise also improve the health of the joints. And next, for most important aspect is check your blood pressure, blood sugar, condition of the heart, health of the kidney, measure cholesterol often at least once in 6 months, and take appropriate steps to get relieved of these symptoms. Consult your doctor for that one. Walking improves the health of the heart. It decreases fat, body fat, increases oxygen level, and reduces the carbon dioxide level in the lungs, where the exchange of gases, these two gases takes place. Carbon dioxide is produced in the body and it is carried to the heart through the bloodstream, and in the alveoli of the lungs are the air sacs. The walls of the air sacs is so thin that it allows the exchange of carbon dioxide to atmospheric oxygen. So the blood carries the atmospheric oxygen and gets back to the circulation and heart. Friends, in the next episode, I shall bring out some important disease information about the diseases, especially for you. Thanks for hearing. Please like, subscribe, and press the bell button. Till then, Jai Karnataka, Jai India.